843 TV, where the Lowcountry comes to speak.
.843 TV,
where communities come to speak.
And welcome to 843 TV. We are at the Bluffton Jasper Volunteers in Medicine, and it's always a delight to be with Pam Toney, the Executive Director. Always so fun to be here and hear what's going on at the clinic.
Thank you. We're always excited to have you here. And this is a special time for us because we're going to highlight our very special medical staff today. And so hope that everybody will enjoy hearing about why they're here and what they do and the need for them.
That's right. You have grown tremendously over the last little bit. I understand you have seen 6,000 appointments. I've had 6,000 appointments. That's quite a bit to handle.
It's hard to believe, it really is. But between our telemedicine and now our dental program, we're increasing our medication program. And so there are just lots of things that are going on here at the clinic, and it's bringing in more people.
Share briefly with us about the staff that you do need.
Well, we have staffing needs here at our Bluffton clinic, and then we have staffing needs in our Ridgeland clinic. And we're finding that we reopened the clinic about 18 months ago, and we're seeing a steady increase in patients. And so we like to have our doctors in Ridgeland because then our patients don't have to drive all the way here to Bluffton.
Right.
And you know, that's about a 72-mile trip, round trip.
Sure, that's
so
a lot.
If we can bring them here to let them be in Ridgeland, that's so much better for them.
Well, in just a minute, we're going to see a fantastic video to show your facility, but I do want to point out it's so clean and neat and so pleasant in here versus, you know, sometimes it's a little bit apprehensive to come in, but it's so welcoming here, and I just love coming in here too. So I think the best way to do that is to share this video that you all have ready for the viewers.
Great.
All right, let's take a look.
I believe that one's calling to do whatever it is forever, and I just enjoy it, meeting people and being sort of their advocate.
The medical staff provides unbelievable amount of service to our patients here. Recently, we have just completed our annual report and have found out that we have served 1,365 individual patients who came to the clinic, over 6,000 patient visits.
I'm sort of semi-retired, but I guess you could call this the semi part. But I think it's a very satisfying place to work, and I think you can really offer something to the community. There's an awful lot of people here that don't have medical coverage that I think we can offer a service for.
So basically it's really, it's as modern as can be. There's 2 dental chairs, state-of-the-art sterilization units, everything is computerized, it's clean, it's sleek. The patients seem to appreciate the modernness of it.
1, you're doing something really good for people. That's providing the service. 2, we have a great team, so it's a pleasure to work here. It's entirely different from someone who has an experience of having to answer to a for-profit health corporation, see as many people as necessary. And the other thing is, as I mentioned about the patients, they're so grateful.
I heard about VIM through an organization in an area where I live. They had a table, and of course the plea is always to have more volunteers, and it sounded like something that I could really engage in and become active.
I had seen advertisements, I saw the sign for Bluffton Jasper Volunteers in Medicine as I drove along US 278 and thought, hey, when I retired from private practice, this might be a place that I could continue to use my skills, but not in such a demanding way as full-time work.
We have sort of a team approach to our patients, and our patients are sort of used to us being a team. And, you know, we have continuity of care in this clinic, which I think is essential to really enjoying practicing medicine. And it's unique for some free clinics to have this degree of continuity. But our patients, whenever possible, see us They get to know Carrie, they get to know me, they know we both know what's going on with them, both socially as well as medically.
Very nice. The people are super accommodating. We have to understand that we deal only with volunteers.
In order to become a physician or a nurse here at the clinic, you need to have an active license. Now that could be a South Carolina volunteer license, which means that you have limited things you're able to do, or it could be a full South Carolina license. And we're able to help those physicians and nurses complete their volunteer licenses. If they're looking to get a full license, then they really need to do that themselves because there's a lot more involved with it.
I like the friendliness of the staff. I usually have the same staff that I'm working with. I recognize them.
They have a very good electronic charting system here that I think we also can dictate directly into the chart with what they call a dragon system. And I don't think we lack for anything in that area. The charting is very easy.
Bluffton Jasper Volunteers in Medicine is certified through the South Carolina Free Clinic Association. We also have our malpractice insurance, as I've said before, and both of these two entities require us to have a certain amount of standards of quality. And one of those standards of quality is that we meet with our physicians and nurses on a regular basis. And so we have quarterly meetings with our staff, and then each year we have a volunteer meeting where we all get together and discuss new topics. But the quarterly meetings are very important for standards of care because if a physician has a question, the team can sort of help solve that problem.
If somebody can't get in to see one of us and they see the other one, they know what the plan would be. So that's very important, particularly for the chronic diseases.
I think that we really strive to get the patients with a good fit with the physician. I think that there's a lot of give and take, certain personalities, specialties. So I think that that's important at the very front.
Let me just say I feel better when I leave. I feel like I've done something worthwhile. The people here are really kind of uplifting. I mean, they're all here for the same purpose. And for once in all these years, it's good to see people that are doing things for more altruistic motivations than we normally see.
Well, frankly, this was part of my retirement plan because I was terrified of retiring. And when I realized I had always known about volunteers in medicine, I had watched a 60-minute interview about it years ago and been fascinated because where do retired physicians go? You know, we're like old elephants. And when I heard there was a Volunteers in Medicine down the road from where I was sitting in the realtor office thinking about moving to Bluffton, where I'd never been before in my entire life, I was like, okay, this is it, we're doing this. 95 is right here, and I can do Volunteers in Medicine.
To me, I can only say what really has worked for me and what I see, that it's, you know, it's a desire to use a God-given gift. I mean, it's, I think, quite a gift to be able to go and attend medical school and get your degree and to serve, you know, your life, your God, your country in that way. Retirement is not a word that's in the Bible. We need to keep alive, and this is how one of the things I do to keep mentally alive and, you know, interacting with people in a meaningful way.
I would say it's very rewarding. You're treating people who could not be more appreciative. Always thank you, whether it's in English or Spanish. And my Spanish is getting un poquito, a little better. You can always say it's not working for me as far as my time or my schedule. But when you see the satisfaction of the patients when they come in with such bad teeth and you send them home looking so much nicer. I mean, to have a patient cry before they leave because they're so happy with what's happened. I mean, you can't put a price tag on that. You really can't.
Everything I think, in this world, if you don't do it, you lose it. So, you know, if you are not practicing medicine over and over again, then you may lose part of your ability to be able to make decisions on the proper care of patients.
And you know, once in a while your patient said thank you in my previous life, but nothing like down here. And also, along with that gratitude that we're all doing this, comes adherence to the suggestions we're making. These patients are infinitely more likely to take their medications the way I've asked them to do it, to come back when I ask them to do it. They're just so much more invested in their part of the partnership than many of my patients had been through the years, and that makes it very gratifying as well.
If you want to continue to do something professionally at a very low level, just to keep your hand in, this is a good place to do that because the demands in terms of time and energy are relatively small, but the benefits in terms of the feedback that clients provide, they're so grateful for our services, and it's just very heartwarming to be there and know that you are the person who's helping them make a difference in their lives.
I can't bring about world peace. I can't do anything about world hunger, but I can save somebody's life by simply not allowing them to be killed by hypertension. You can fix one person one day at a time, and that's what I do.